Good morning and many thanks for joining us. My name is Lillian Muli, and this morning we're talking about hearing loss, which is on the rise globally according to the World Health Organization. Experts are calling for early detection, better hearing care access, and increased awareness to prevent irreversible damage. My guests this morning, Richard Mwangi, consultant audiologist, Doctors of Hearing. Many thanks for joining us this morning.
Thank you.
And we're also joined by Mercy Karanja, clinical audiologist, Nairobi ENT Clinic. Many thanks for joining us, Mercy. I'll begin by putting a question to you, Mercy. Let's begin with you. Let's begin with the basics in terms of what the importance of hearing is as regards a person's overall well-being.
Thank you, Lillian, for that question. Now, when it comes to hearing, of course, we use it for conversation. That's what makes everybody to be able to understand conversation. So that's why the importance of hearing is. And most when it comes to health, we usually say that hearing not only helps us only hear, but also help us just knowing our surrounding. You know, us understanding the cues on conversation, being able to interpret words, being able to hear that small, soft, communication that people make. Let's say you're in an office or making a conversation with somebody and you don't want to keep on, you keep on saying something like, pardon, or you didn't hear very clearly. So most of the time you find when somebody has a hearing loss or they're not able to hear very clearly, it's going to affect their overall performance, overall how they, communicate with other people. Whether it's children, whether it's adults, especially with children, they're going to have poor performance in school, and very young children are going to have delayed speech development. So when it comes to hearing and hearing care, it usually starts from the very unit when the child is being born, because it affects their development. Just starting from word development, where by 1 year of age, or let's start even from unit, from 3 months, the child should be able to startle to noise. The moment the child doesn't startle to noise, then we usually say there might be a problem, they're not be able to hear. By the time the child is reaching around 1 year and they're not able to turn to sound, and probably it's because of a hearing loss, then that will be a problem because the speech development is going to be an issue. So when it comes to hearing, it affects all age groups, just starting from the child, when the child is born, going throughout to old age.
Yeah. Because, the common perception is that hearing loss affects the elderly. And so what you're saying is that you're seeing younger people also showing early signs.
Yes. Now, what even we're advocating more is more even on neonatal screening, because hearing loss can start from birth. It can be from congenital, of course, a child being born without hearing, and sometimes it can come even from the complication of birth, especially, let's say, if the mother had some complication during delivery, or if the child was born low birth weight, they were put in the NICU because probably, there was a bit of difficulty in their delivery. So those are children we call at high risk, and they might develop, hearing loss. So it starts from the moment a child is born, going all to old age. So hearing loss is not only on specific age group.
Richard, I'll come over to you now. We've often heard about a link between untreated hearing loss and brain health. Let's talk about the link and the connection between the two.
Thank you very much, Lillian, for such an important question. And we talk about untreated hearing loss. It's where people have delayed looking for a solution. Because in our practice, what you find is that by the time you're taking history, that you find this patient telling you, I've had this problem 2, 3, 4 years, or even some 10 years ago. But then the issue is that what is really affecting, apart from not hearing, what is the consequences of untreated hearing problem? You'll find that in these guys is that they start isolating themselves. What you talk about the hearing impairment vis-a-vis the mental health. They start isolating themselves. You'll find that by the virtue of isolating themselves, they get into a situation of depression. They get to a situation of anxiety. By so doing is that you find that this person is withdrawing from engaging with community, engaging with their social and the social grouping that they go in. You'll find that if they are in their prime age of career, they're finding difficult following a meeting. You find that if they have to go for a conference, they have to look for a strategic position where they can sit down and listen to a conversation or a meeting, what is going on. So we are advocating that however much you find that hearing loss is mild, it needs to be attended so that at least the solution can be taken. Yeah. Now, when you talk about the untreated hearing loss and the brain health, is that you find that this patient will also start experiencing what you call cognitive decline. So cognitive decline, or what you talk about cognitive function, is how the brain works. So when you don't have a good hearing, the brain starts, making some rearrangement by itself. And then you find that you start finding the small tasks that you used to handle. Maybe you become so forgetful. Maybe you started, getting frustrated. You start finding that by the end of the day, you have what you call auditory fatigue. And more so, the cognitive function starts declining, where you find that most of the patients that are having untreated hearing problem, they have got high chances, or they are at risk of getting dementia.
Right. Yeah. But let's just zero in on some of the warning signs that somebody might be experiencing hearing loss. Richard, I know Mercy touched on certain issues around perhaps somebody, repeatedly saying pardon, pardon, because they can't hear you. Those are the basics. But some of the warning signs that are perhaps overlooked that could indicate that there is a problem.
Yeah, there are many signs that are overlooked by people, and you find that normally you find that people saying this, I don't like going to such a kind of a place because the acoustics are not good. In the airport, you find that I don't hear the PA system very well, and other people are listening to it. I don't go to church because the speakers are not good. So what happens in a hearing problem is that it doesn't have those cues. There doesn't pain, there's no information, there's nothing to push you to go and look for the hearing doctors as fast as you can. And that's why people take time. So you find that when you are left in the house, the volume will tend to be loud, but you might not notice. Any other person coming in the room, you find that the TV is too loud. And then you find that also people having a conversation is that they keep on, pardoning. Something interesting Mercy mentioned is about neonatal hearing screening. We normally advocate even from birth. So at birth, a child can get a hearing screening, what we call neonatal hearing screening. And then if it fails, it can be repeated after 3 months. Yeah. And the intervention can start even as early as 6 months, something we call 136. So you screen at around 1 month. If the child fails, can fail because of so many reasons. Maybe the child was crying, maybe there was fluid in the ear. You repeat after 3 months. Yeah. By the 6 months, if the child still fails, you do diagnostic and intervention starts from there. So what you're trying to do is that you're making this child to develop speech with the peers and will not be delayed in speech development. Right. Because if the speech is delayed, you find that everything else in school, also the child talk, it will be all delayed.
Right. And Mercy, there's a growing conversation between hearing and physical balance. Please unpack for us what the connection is between the two, and when we zero in on hearing loss and how that ultimately affects our balance.
Okay, that's quite interesting because people think about our ear as just for hearing, but our ear is not only just for hearing, it also controls our balance. Now, just to break it down, what we need to know is that our ear has like 3 parts. The part of the outer ear that just receives sound from outside, and then it has our middle ear, that amplifies sound. And then it has the inner ear, we call it the cochlea, our organ of hearing. That's where sound gets to be amplified, to be stimulated so that the brain can be able to interpret that. But just next to the cochlea, our organ of hearing, it's just our organ of balance. We call it the vestibular system. So they're like conjoined. And the most interesting thing is that they use one nerve to communicate to the brain. Okay, so once somebody is hearing, the sound will go from the outer ear, going to the middle ear, to the inner ear. And that inner ear is just adjacent to the vestibular system, our balance system, and then uses the same nerve to communicate to the brain. So of course, if anything happens to your inner ear, that part of hearing, and let's say something happens like a sudden drop of hearing, because a sudden drop of hearing can happen. We call it a sudden hearing loss. You just wake up one day and you're not hearing as good as you are. Then most probably even the inner ear balance system is affected. Now that part of our balance system is the one that holds our balance sensors. us being able just to, find our stability, us being able to know our spatial orientation, being able to sit upright, turn left and right, it usually happens in the ear. So anything happening in the ear, even just a small hearing loss, will slightly affect our balance system. Yeah. And that's why we usually say that hearing and balance are connected, because those two organs are conjoined.
Would you then say that patients or persons with hearing loss are more likely to experience physical injuries, perhaps even falls?
Yes, that's definitely what we usually say, because as we said, those two organs are conjoined. They use the same nerve to communicate to the brain. So let's give an example, like you have just a mild hearing loss. That mild hearing loss is going to affect, even if it's very slightly, our balance sensors. And you are more likely to feel a bit unsteady. You are more likely even to trip and fall, other than a person who has normal hearing or a person who has treated hearing loss. Because sometimes we want to say it's untreated hearing loss that can cause, those falls. So most of the time you'll find that also when it comes to hearing, you use it for environmental cues. Somebody telling you, watch out. You use it to be able to hear background noise. Just to, when you're walking, you want to know who is behind you. Is there something that is behind you that you need to be aware of? You need to be able to hear that ringtone, that alarm that is causing, telling you to watch out for danger. So if you're not able to hear that, or it's mumbled, or you don't know even the directionality, especially for people who have unilateral hearing loss, maybe, or a certain degree of hearing loss, they're not able to tell where sound is coming from. Yeah. So even if there's an alarm somewhere, alerting them of danger, or if they're walking somewhere and it's dangerous, they're not able to know those environmental cues, so they're more likely to be at risk of either falling or even being at risk of environmental dangers. Mm-hmm. So most of the time we say yes. If you have a hearing loss, because it's connected to your balance system, you're more likely to be in danger of injuries or even fall. And even research has done, some research has been done just connecting those two. And they usually say mild hearing loss has like 3 times likely for a person to fall than a person who has normal hearing. Mm-hmm. So if you just have a mild hearing loss and you are more likely to fall 3 times, imagine now if you have a more degree of loss, like a moderate loss or a severe loss. Mm-hmm. So that is somebody who even balance, is affected. The way they walk, the way they know the directionality of a place, it's affected. Starting from a very early age, even with children, if they have hearing loss starting from the neonates, when they're developing, they are more likely even to, to fall when they're playing down, because the balance system is also affected.
And before we get to the conversation around, remedial approaches, hearing aids and what have you, Richard, I want you to talk into ENT, ear, nose, and throat, this entire system. And Mercy here talking about the ear and the different components and the whatever is going on inside there. So when we talk, for instance, about ear care, debunk some of the myths. For instance, just the common use of the earbud and what could happen there depending on how you use that earbud. Secondly, just ear hygiene overally, accumulation of wax, what effects that could possibly have. And when we have persistent ear, nose, and throat infections, how that could ultimately affect the throat, the ear. And I'm talking about this zeroing in on perhaps the pediatric cases where we see children getting admitted or visiting pediatricians a lot over ENT issues.
Good. Thank you very much, Lilian. Now, when you talk about such an approach, is that ear, nose, and throat, they are connected. They're connected through a tube called eustachian tube. And from that, we brought this model of the ear and to show what exactly the ear looks like. Now, what people commonly call an ear is this. Now, this is where the production of wax happens. Now, what happens is that the wax is supposed to be there. It's not a mistake that the wax is produced by the ear. But people find that they want to clean it using the cotton buds. Yeah. Now, that's a mistake, and that should not be happening at all. Because as much as they want to clean it, they push more wax towards this part of the ear, and the ear will not be able to push. The skin inside here is like a conveyor belt. It pushes out the wax, and that allows the wax to come out. And that's the time, when you're showering, using the bathing towel, you find that there's wax in your bathing towel.
Yeah, just all of a sudden my ear just got itchy.
And then what happens is that people think that it is too much inside the ear and they want to use the cotton buds. If you look at any brand of those cotton buds, it's written it's not to be inserted in the ear. Any brand, not mentioning any brand, it's written, there's a disclaimer there in small writing that is not supposed to be inserted in the ear. But you'll find that in the shopping list of our people is that they continue buying them, and they continue using. There's so many dangers apart from pushing at that wax. We have seen cases, and also Mercy, I'm sure she has seen so many cases of injuries, accident happening, that someone will use a cotton bud, and then they somehow forget, they lie on that ear. So what happens is that they perforate the eardrum, which turns out to be more bigger case of surgical intervention. It may heal, it may not ever heal. Now it's such another journey that will never be as normal as it was before. So we advise them not to use those cotton buds. Then they'll ask themselves, how do we clean the ear then? The ear cleans itself. You have no business cleaning the ear. How far you can go is where your bathing towel can reach.
Right.
That's all. That's all.
Good.
Now, another thing is that for the persistent infections is that they need to be treated, especially for children, especially for pediatric. Why? Is because as for much they are happening, let's say, there are persistent infections happening for children as we see them, they cause a buildup of fluid in the middle ear. Now your cameraman here can zoom. So they cause a buildup of this part. So they make the eardrum bulge, and then eventually it can burst, then causing a perforation in the eardrum.
Wow.
So they need to not do over-the-counter treatment. Let them see the ENT doctors, and then it can help them to look for diagnosis and treatment. Basically, what we do as audiologists is that we help in screening and testing them to see whether there's buildup of the fluid here, and we assess through the eardrum and see where there's fluid. If the fluid is built up, we send them for the ENT for treatment, and the treatment will be optional by the ENT what it chooses or not, and then you find that this child will be taken care of. Then, if there's a hearing problem, and if there's a unnoticed hearing problem, it can be noticed at that time by the clinician who is attending to the child, by taking through the history, speech development of this child, how has been the milestone, how does he relate to their peers, all those questions we ask. And then if there's a hearing problem, it can be taken up at that point, and you find that speech development can also happen, intervention of the hearing aids or even the cochlear implants.
Right. We're going to get to hearing aids very shortly, but before that, Mercy, I want to bring your attention to something you had talked about, and that is on issues with hearing and balance. If somebody notices issues with hearing and balance, are there ways to mitigate this type of risk?
Yes, of course, there are ways to mitigate those type of risk, because one of the things you need to do once you find out that you have a hearing loss is to have your hearing checked. Why? You are more at risk now. You need to think about your safety. So one of the things you need to do is get your hearing checked. The other thing, of course, to mitigate falls and risk is also, if you have had a history of falling, is you need actually to be more aware of your environment. You need to take that extra caution by, whether it's in the house, you need to remove those loose rags so that because you're more likely to fall if you have a hearing loss. So you need to be just aware of how the environment is. In the bathroom, most of the time I tell my older patients that put those handrails so that you're able to hold and support yourself. Because sometimes the dizziness comes as not just imbalance, but it comes as something we call vertigo. You feel like a spin, a dizziness that comes in. So, and it's going to make you lose that spatial orientation, knowing you're going to feel like the room is going round. So most of the time, how you mitigate that is just be very aware of the environment. And of course, if it happens once, then you need to have a hearing checked. Once your hearing gets checked, you need also to be done what we call a vestibular assessment. We say that part of the inner ear that controls our balance, that is just connected to the organ of hearing is called the vestibular system. And now the test that we usually do just to see how it's working, is it functioning okay? We do a vestibular assessment. So you need to go to your audiologist so that they can have that assessment being done and find out, why are you finding the room spinning? Is it just to do with a hearing loss that you might be experiencing, or is to do something else that is going on in your vestibular system? Why sometimes when it comes to balance, there are so many things that affect your balance. One, we've said, of course, it can be a sign of a hearing loss. Second, it can be an infection. The other thing, it can be a viral infection that is happening. And mostly even patients who have other comorbids, if they're hypertensive, if they're diabetic, you know, if they're being treated for any chronic illness, they're more prone to have dizziness. And also for people who maybe even work out and, you know, they're staying in one position for too long, they're more likely to feel off balance.
Right.
So most of the time we don't assume that it's just a hearing loss. We want to find, you know, we want to dig deeper. The balance issue, is it to do with the vestibular system just being not working okay? And then we are able to manage that.
All right, so as experts, you've diagnosed this as hearing loss. Let's talk about solutions in terms of ways to hear better or ways to lessen the discomfort. And this is to both of you, starting with you, Richard, perhaps. The new generation of support in terms of hearing aids, what does that look like? And what features are we looking at? Traditionally, we know hearing aids to be bulky, very prominent, very visible, even to somebody who perhaps doesn't know that one might be experiencing hearing loss. So let's talk about solutions in terms of remedial approaches once the hearing loss is actually diagnosed.
Thank you, Lillian. When you talk about the remedial solution for the hearing loss, we'd want to talk about different types of the hearing loss. We talk about conductive hearing loss, we talk about sensory neural hearing loss, and we talk of both, that is sensory neural hearing loss and conductive hearing loss. Now, the approach is different depending on the severity of the hearing problem, because hearing impairment or hearing loss is not standard. We talk of people having of mild, we talk of people having moderate, we talk of people having moderately severe, and the worst case scenario where the person is profound, or where we say somebody is deaf. So the approach is different from that angle. Now, there's so many solutions in terms of the hearing aids to be picked for each and every case for a patient. So it's case by case, depending on the diagnosis, on the test that we're going to do. For adults, we do pure tone audiometry, tympanometry, just to look for assessment of what we are looking for, the severity of the hearing problem. Now, there's different hearing aids, different case. Now, we know hearing aids as big, beige, hearing aids, something that is big, something has been stigmatized as it is too big. That's what people know as a hearing aid. But now, this technology has really changed to come up with a very small hearing aid. It is something like what you're having here. This is a full hearing aid.
Okay.
Long ago, the hearing was that big.
Can we get a better shot of that? This looks like what an earpod would look like.
They're trendy and nice.
Yeah.
So if you compare the big, what people know in the back of their mind is something of this size. This is the current hearing aid, the way it looks like. What has been known is that big. So it has changed, and it's coming different color. If it is your skin complexion, you have something that is of your skin complexion. Yeah. If it is for a child, there's something for children. You can even have it, printed, those cartoons they like, so that at least that stigma cannot be there anymore. But apart from that, apart from the size, apart from being, looks like AirPods and things like that, what is the technology has changed? Previously, what has been there for hearing aid, there have been like a miniature public address system, because it's something we knew about: microphone, amplifier, and battery to be operated on. Now they've come to be rechargeable. They're becoming to be having different channels. We talk about 24 channels, 16 and 12. So all that is to fit on different preferences of a patient. All that is to fit on any severe hearing problem of a patient, and all that is to make a patient comfortable. Some of reviews we are getting nowadays for the new trends of hearing aids is that patients are forgetting that they are wearing it until they remove it, and then they find that, oh, I spent the whole day using it and I could hear very well.
Yeah.
Because so much has changed. Today's hearing aid, they are the hearings that tries to mimic how the brain works, and they give you more of clarity. It is no longer more of a loudness. Our concern is not about the loudness anymore. Our concern is that we understand the patient, what they are going through when they have hearing impairment, is that the clarity of the sound is not very good. That's why you find somebody with a hearing impairment, and what you talked about untreated hearing problem is that somebody who has got a hearing problem is that they would like people to talk in front of them, okay? Saying that I hear you well when you are standing in front of me, but it's not hearing. What they want to do is that, yes, they can hear that sound, but when you look at them, you see the movement of the lips. They are doing more of a lip reading.
Richard, this is the manufacturer, what we're seeing on our screens behind us. That is what we're talking about as regards this hearing aid. Very quickly, before I cross over to Mercy, there have been concerns about hearing aids. People that I've interacted with that use hearing aids, I mean, perhaps not as sophisticated as this, talking about regulating the sound. The hearing aid actually getting to be more of a discomfort than a solution.
Yeah, as a manufacturer, what they have done is that we're talking, remember I've said that you're not concerned more about the loudness, we are concerned about the clarity.
Right.
So manufacturers, they are concerned, and Staci being the leading, one of the leading manufacturers in this product in matters of hearing healthcare, is that they are so concerned about the clarity of the sound, because it is the clarity that will improve. Anybody who have got a hearing problem, they hear sounds being muffled. You try to listen, and that's why I remember as I started, I say somebody get auditory fatigue by the end of the day, because they keep on listening and they cannot really understand, they get frustration, the mental health is affected because of their hearing impairment. So the hearing aids, they have improved in more of clarity, and especially when patients are using it. What they have talked about the loudness is more of the old hearing aids that has been there making a lot of noise. The hearings of today, you can even regulate them using your phone. You can use any phone. So when you're using it and maybe you find the volume is too low, you can just get to your phone, regulate it up and down. They become more of a wearable.
So it's AI enabled, you can put it on your Bluetooth.
Yes. Okay. So what you're talking about the AI is that the manufacturer, they have integrated AI so that when we are audiologists, we set up the hearing aid, we program according to your levels of the hearing. Is that the AI configuration helps you to manage the sound qualities wherever you are. Be it in the supermarket, be it on the street, be it in church, wherever you are. The AI manages how the sound you're receiving. So it's not the way that people say that when you have a hearing aid, the sound will be too much. It's not that it will be too much. It is just adequate of what you need to hear. Yeah.
Thanks for that, Richard. I'll get back to you. Mercy, we're talking about this assistive device, particularly zeroing in on this Staci hearing aid. You had talked about falls and cognitive engagement. Help us understand how this device, assistive device, will help perhaps detect falls, help track your cognitive engagement. What more, aside from the hearing aid, or rather the improved hearing, is this device able to achieve around those areas?
Okay, thank you. So let's just make it simple. When it comes to hearing aid, I usually tell my clients it's more about the technology of the hearing aid, because the technology of the hearing aid will give you what you most need. And when it comes to probably the Staci hearing aids, they have the new innovation with AI, where it's not just helping you hear with the clarity of sound that Richard is talking in, but it's also healthable, that it goes more than just hearing. And that's why we love it. Why? One of the things that it usually has, it has a connectivity on your app on the phone, where it can be able to engage with you in a healthable way. One of the things that it's going to do, it's going to give you the steps when you're taking. It acts more like a smartwatch. You know, the way you go and you have a smartwatch and it can be able to tell, how many steps you have taken. It does that, so it makes you remain active during your day. The other thing, it has what we call brain engagement, that it's more likely to be able to tell when you're having conversation, how much you are engaging. And by the end of the day, you are able to look back in your app and say, probably today I engaged 40%, I need to do much better. Yeah. Especially if you had had a hearing loss that had made you isolate from conversation, had made you a bit depressed, and you want to take that health back. So this hearing aid is going to give you that steps that you have engaged this much. Yeah. Why I like it, because I'm more inclined when it comes to balance, is because it has also the fall alert. Now this fall alert is a new innovation because what it does, it usually checks your motion, and if there's a sudden motion of a near fall, it's going to send a message to a loved one and tell them that Lillian fell down. Okay, so it's usually mostly recommended for people who are living alone, especially for the elderly. It's very, very good, because let's say you get a hearing aid for your elderly parent and they're more likely to fall because they have a hearing loss. Yeah. If that happens, whether they're falling because of the hearing loss or maybe they've had even a heart attack, the hearing aid is going to send a message that it has been said to that particular person or the guardian. Now, the new innovation Edge that has just come out, it has now even a balance assessment tool. So that you can be able just to follow up in your app and be able to assess yourself. How well are you steady? How is your balance? And it's able to take you through steps to step to know whether you have an issue that needs further, investigation. So that's the new feature. So we are saying that the hearing aid is not only for hearing, but it's also healthable, and it helps in all those areas when it comes to hearing and balance.
Thanks for that, Mercy. I'll get your winding remarks now, and I want to start with you, Richard. For those looking for more support on Starkey, where can they go, and how can this assistive device be a resource? And of course, the affordability, which is key.
Yeah. Now, for Starkey product, coincidentally, Mercy and I have been fitting this product for some years now, and we have seen the advancement in technology. Not that you've not done other brands, we have done, but in comparing other brands, that you find that the user flexibility, which is very important for us, that you talk about how will the patient go home with this product and use it. It is more, user-friendly. The interface is so easy. Connectivity is very easy. Now, when you talk about where you can get them, is that, Mercy from Nairobi ENT, they are doing that. Product, they stock them and they are available. For us, doctors of hearing, we stock the hearing aids and maybe some other selected people who are stocking them. Because what Starkey has done is that they have to train you on the product. You just don't go and pick the product and start fitting. Remember, this is, it's more or less, it's a computerized device that you have to have a know-how. And then the manufacturer is being kind enough, wherever they bring up the product, like now the Edge AI, the one Mercy is talking about. We as audiologists, I have normal hearing, she has a normal hearing. We have to wear it and get to understand what will be this we are telling the patient about this product. What about that balance feature that Mercy is talking about? We have to experience firsthand so that by the time we are getting it to the patient, we have first experience about the product.
Yeah.
About the affordability is that, remember I said, hearing is not standard. So, and also the hearing aids are not standard. So it's not that you call in and say, I need a hearing aid. That question cannot be answered. We'll tell you, book an appointment with us. Let's have you in the office. We take you through the testing. We see whether you're mild, moderate to severe case, and then we start the discussion there. So it has to be done. So we don't have what we call an over-the-counter selling point of the hearing aids. We have what you have to take you through diagnostic assessment so that we can reach at a point where we say, this is what suits you best. Yeah. And tell me, no, my husband or my friend uses this one. I say, no, hearing is not standard.
That's fine, Michael. But very quickly, before I just cross to Mercy for her closing remarks, the user flexibility of this device. Already the feedback we're getting is how can the aged population be better able to be compatible with this device, seeing that it's coming, of course, with a lot of technological backup, such as the phone, perhaps the AI, the Bluetooth as well. For an elderly, patient who might not be as tech savvy, how then do you advise that they go about using this assistive device?
See, the hearing itself is tech savvy by itself. Remember, the integration of AI, the patient I need to know this. All this is done. So we are talking of an auto synchronize of the hearing aid. When you talk about the phone, it's another added advantage. Otherwise, you can use it without that.
Okay.
So when you're using it, you can use it plug and play. In fact, this is how it comes in. So when you give it to you, of course with a charger, this is what you get. So you charge it there, this is a charger, and then in the morning you wear it.
Right.
So remember, you also say this is automatic settings that the AI has been integrated. So it is very, very easy to use, comparing to what we have been there before, which you had to use the battery, and we used to experience so many breakages of battery door and also battery leaking into the hearing aids. So it is, when we talk about the AI and all that language you're using of technology, is that it is integrated into it. So when you get it as a patient, your work is just to use it. Okay. And maybe probably the most you can do is just to clean the bit of wax that can be accumulated in it.
Right.
So it's a very simplified device that you don't have to worry about what kind of smartphone do I need. So if you knew you don't use a smartphone, you can use it the way it is. Remember also, for age, they are not so much active in life. They are not, every day in meetings and things like that. So the much you put by the time you are doing the mapping or the programming of the hearing aid, it's enough for them and it do wonders for them.
Mercy, I'll get your winding remarks as well in terms of how this can be a resource. And very quickly, just to address a concern from a parent here who is saying, in terms of ENT, there are certain pediatricians who advise that syringing is used to clean out that wax. How safe is that? How frequently should it be used? Should it be done?
So let's first answer that question for pediatric, because it's a concern that even if a pediatrician says that there is wax buildup, the patient has to be seen by an ENT. While the cleaning up or the syringing that we usually say has to be done by a professional. And most of the time it has to be inbuilt impacted wax, not just wax. What I've found that most of the parents, they look at the ear and they find just a bit of wax and they say, oh, there's a lot of wax. But the ear is supposed to have wax, and it's only supposed to be removed when it's creating an obstruction. If it's not creating an obstruction and we can look into the ear and see the eardrum, then we don't remove the wax. So there's usually no routine in cleaning the ear other than when it has created a problem, and that's the obstruction. And that's the time you go to an ENT and they look inside and they're going to recommend a professional cleaning of the ear. So that's what we usually say. Don't clean your ears if it's not recommended professionally and if the buildup of the wax is not obstructing.
Right. And now your winding remarks on Starkey.
Now, we've said about the innovation, which is quite great, because it's modern. It has given us that glow up where people used to expect the hearing aids just to be amplifiers. Now they are smart, healthable devices. And Starkey is one of the leading innovation for that. So most of the time we usually say that when we have this conversation when it comes to hearing aids, let's talk about what best suits you. What technology will best suit you from a child? Are they going to need that innovation? Because the Starkey products are starting from a very basic range going to a premium technology. So when we come and have this conversation to do with hearing aids, it's not that one suits all. We usually get to know what particular hearing aid, with what features they're going to get, right, so that we can be able to recommend that. But the first thing is usually get your hearing checked, whether there's even you've had a very any problem when it comes to hearing, whether it's ringing in your ears, feeling blocked in your ears, dryness in your ear, feeling pain in your ear, the first step you need to take is get your hearing checked.
Many thanks for that. We've been talking to Richard Mwangi, consultant audiologist, Doctors of Hearing, and Mercy Karanja, clinical audiologist, Nairobi ENT Clinic. We're back with our second topic of the day this morning, and we will be with you in just a bit. Stay with us.